I'm going to go through a little sequence that you can do to help release lower back tightness. This is really suitable before you do any other mobility work or any other exercise, or even just throughout your day to give you a little bit of light relief through tension in your lower back. So just go with me on this one. We're going to start off just lightly tapping your lower back. So here, either side of your spine, you have these two predominant muscles which are often pretty tight. So we're just going to create a little bit of sensory awareness just by lightly tapping all along that muscle. You can go a little bit faster if you like, go a little bit wider, go down to the top of your glutes. And we're just going to brush it down. So you can brush that down the side of your hips, down the side of your torso. So what you're imagining you're doing right now is just freeing off the layers of fascia, getting rid of any kinks and tightness. Okay, shake it out. What we're going to do next is I'm going to find that muscle on your lower back, either side of the spine again, just where it bulges out when you bend over. So place your fingers on there and just gently massage that area, create little circles. You can always just grab it a little bit and pull it apart, pull it wider. So we're just loosening off the fibrous tissues. And then come back to the original position. Place the fingers really firmly on the bit that bulges. And I'm just going to hinge forwards. So we're going to do two different ways. So first of all, by sliding your hip bones back, so a hip hinge, what you'll notice is your lower back slightly switches on when you do that. Try it and try to feel the muscles switching on. So it'll just be a little bit of tightness that appears when it activates. Try and find the position when you're going forwards where it activates equally on both sides. So you may just have to play around with the position of your hips. Maybe when you're bending forwards, you notice one side switch on first, but that hip is slightly forwards. So level the hips. Maybe it's a case of leaning your shoulders or torso a little bit more to one direction than the other, and that will mean that you're going more equally. And then we're just going to flex the spine instead. So here, rather than hinging at the hip, we're just tucking the chin, rolling down. You can sort of bend your knees and come down a little bit more, but think about tucking the tailbone under instead. So we tuck the tailbone, tuck the chin, roll, come back up, tuck the tail, tuck the chin. So keep the knees soft as you do that. Let's do 5 like that, so 3 more. Bend the knees, tuck the chin, tuck the tailbone. So by tucking the tailbone, we're sliding it down. Come back up. All right, now shake it out. Maybe you already notice a little bit more looseness in your back. So just stack your joints, stack the shoulders over the hips, over the knees, over the ankles. All right, so now placing your hands back, either side of your spine, just where the muscle bulges out. Press down firmly, and now what you're going to do this time is bend your knees and then pelvic tilt, so anterior and posterior. Be consciously aware of what you're feeling. Is one muscle switching on more than the other? Is it easier to go one way more than the other? Feel free to change the position where you're holding on, maybe go a little bit higher up. Maybe go a little bit further down. Then try sliding your hands down a little bit further, just where your spine meets your pelvis. And then just find that pelvic tilt again. Walking hands back up the spine a little bit, or either edge of the spine. Okay, shake it out. How does your hips feel now? Cool. Now we're going to do one more thing. So here, you're just going to take hold of your arm with your fingers either side of your wrist and just gently pull the skin down. So now start to lean, reach the shoulder as you pull the skin. And then we're going to move that into a little bit of flexion and rotation. And a bit of lateral flexion as well. So we're pulling that layer of fascia, which all attaches down the body, down your back. This helps to loosen off your lat underneath your armpit. So here you can play around with it a little bit more. Try stepping the opposite leg forwards. Maybe come higher, maybe come lower. And we're going to switch sides. So again, just take that little tug forwards and back of the skin. And start to pull the arm as you pull that little bit of skin. Rotate the shoulder around. Rotate the torso. I'm going to try not to hit anything. Always advisable. Making sure you feel that length here, more so than moving from the shoulder. Lengthening the side of the body. Then try stepping the opposite leg forwards. That helps to lengthen the line of fascia. So another view from this, opposite leg steps forwards. As you do that, rotate the chest around, rotate the spine, a little tuck of the tailbone of the leg of this arm that you're stretching. Cool, shake that out. Have a little feel. Come back, gently massage the lower back again. Fingers either side. Find a little bit of flexion, hip flexion, spinal flexion. And then a few more pelvic tilts. Awesome. Give it a little shake out. We're going to take the hands onto the shoulders, gently lift that always a touch. And then side bend. So here, to get true spinal side bend, your hips stay still. So we're not shifting the hips at the same time. We're just lengthening one side, shortening the other. So in fact, try this. So we're lifting the fascia and sliding the little tissue underneath the skin up and down, up and down, up and down. Give it a little shake out again. Okay. So as we lift the knee, this activates the lower back and the fascia of the lower back. So what we're going to do here is we're going to, with your left hand, palpate just beside your spine, below the rib cage. So just a little bit higher up maybe than what you have been. And then you're going to take your right hand onto your butt cheek. And then, so just starting with your right hand, you're going to lift your right knee up in front, and as you do, you're going to slide your hand under your bum, under your leg. And then come back as you lower the leg and take it a little bit behind for extension. So you're going to slide the hand up, slide the hand back, slide the hand up, slide the hand back at the same time. Now here, your left hand, you're going to pull that fascia down as you lift the leg and then slide it up as you come back. So slide the left hand down, slide the left hand back, slide the left hand down, slide the left hand back. So about 10. Then we're going to switch sides. So this time you take your right hand to the bit of bulging muscle either side of the spine, just underneath the rib cage. Your left hand is going to go on your bum. First of all, just slide the hand from your bum up the leg. And now start to slide the right hand down and up, down and up, down and up, down and up. Just imagine the tissues of the body sliding with you, just like your skin is sliding across, sorry, your clothes are sliding across your skin. Awesome. Shake that out. Do a few little figure of eights through the pelvis, and just notice how it feels. Give the arms a little shake. Take the arms up overhead, find a side bend in each direction. Just a few times, again keeping the hips still, finding that length in the side, so you can always put your hand on the hip, pull that fascia down as you lift the arm. But that feels really nice. So by loosening the fascia, which is a thin layer of adipose tissue and connective tissue that allows your muscles to connect to each other or to connect to the bone, depending on the situation and the place in the body. By loosening all of that off, it helps the muscles to then glide and flow and be as effective as possible. So this is sort of semantic movements based on the Franklin method. But it's always worth a try, seeing if it works for you. And then you can follow this with any other back stretches that find that work for you, maybe some rotations, some spinal rotations on the floor, the child's pose, anything like that, which gives you the deep stretch in your body that you need, and will be perfect to do just after this. So if you have any questions, feel free to ask, and hopefully see you soon.